Understanding clinical trials.
Hi, I'm Dr. Paul Applenow. Each year, thousands of Americans participate in medical research studies called clinical trials. Clinical trials are essential tools for scientific discovery. Doctors use the results of these studies to learn which new treatments might help patients with different illnesses. And they can also be critically important because they can show which treatments are not helpful. Many of the most commonly used medical treatments today, including medications, surgeries, and other procedures and therapies, were proven to work by studying them in clinical trials. Clinical trials can look and feel a lot like the kind of treatment you might get from your own doctor or nurse. In fact, it may even be your doctor who recommends that you join a clinical trial and who cares for you while you're in the trial. In a clinical trial, you often have the same kinds of tests done that you would have if you weren't in a trial. But there are many ways in which clinical trials are different from the treatment you get as a patient. This presentation will help you understand some of these important differences.
What are clinical trials? Clinical trials are scientific tests of new, possibly helpful treatments. They are meant to answer the question, does a new experimental treatment work better than the treatment that is already available? Clinical trials are not primarily meant to benefit the people who participate. Typical clinical trials compare two treatments. People in one group get the best currently used treatment. That's called the control group. People in the other group get the experimental treatment that's being tested. Researchers compare how the two groups do to see which treatment works better. Clinical trials differ from usual medical treatment. In order for researchers to get good information from clinical trials, there are some differences compared to the way treatment is ordinarily delivered. Without these differences in clinical trials, we would know a lot less about which treatments work and which do not. A little later, we'll give you some information about a trial that is not being carried out right now, but for which you might be eligible if it were. How are clinical trials different from usual treatment? In clinical trials, the treatments, for example the medication doses, are set by rules called protocols, not by the doctors or nurses who provide the treatment. Also, participants are assigned at random, that is, by chance, like flipping a coin, to one of the treatments being compared. Finally, the doctors and nurses who give the treatments don't know which treatment a participant is getting. We say they are blinded. Why are things done differently in clinical trials? In order to figure out which treatment is better, researchers need to make sure of these three things. First, the treatments need to be given in a consistent way, according to a set of rules called the study protocol. Second, people in each group, both control and experimental, must be as similar as possible. If one group is healthier than the other, it would skew the results of the study. And third, the doctors and nurses who determine how well the treatments are working must be fair and unbiased. For this reason, the doctors and nurses can't know which treatment someone is getting. Let's look at each of these in turn. Difference number 1. The treatment is controlled by a set of rules. In usual treatment, your doctor adjusts treatments, for example medication doses, according to your individual needs. For example, if the medication is making you sleepy, your doctor may lower the dose. Or, if the medication doesn't seem to be working, your doctor may raise the dose. The doctor might even add another medication to help you get better more quickly. But if this happened in a clinical trial, some participants wouldn't be getting the same treatment as other people in their group. This would make it hard for researchers to tell if one group did better than the other because their treatment was better, or because they got more medication, or a different medication. Using a protocol keeps the treatments within each group similar. To make the treatments within each group as similar as possible, the treatments are controlled by a set of rules called a protocol. The rules tell the doctors what the dose should be, when they can raise or lower it, and also how long the treatment should go on. The protocol will also say whether other medications can be added and what tests should be done. That way, the two treatments, current and experimental, are more tightly controlled than they would be in ordinary treatment. And if one of the treatments turns out to be better for most people, the researchers will be able to tell other doctors exactly what to prescribe. Difference number 2. People in the study are assigned to treatments randomly. Remember, in usual medical treatment, a doctor chooses the treatment he or she thinks is best for you. But clinical trials are done when we don't know which of the two treatments, the current treatment or the experimental treatment, is better. If researchers already knew which treatment worked better, there would be no need to do the clinical trial. So in a clinical trial, doctors don't choose which treatment each participant gets. Instead, it's done by someone who never sees the participant, and not on the basis of anything specific about the participant. This way, every participant has an equal chance of getting either the current or the experimental treatment. Why can't doctors choose the treatment? If doctors got to choose, trial participants in the control and experimental groups could differ in important ways, other than what treatment they're each getting. For example, the doctors might pick the sickest patients, or the oldest ones, to be in one of the treatment groups. That would make it harder to tell which treatment really worked better. So one of the treatments could look worse than the other only because it was given to people who were sicker in the first place. Assigning people at random makes the groups similar. In order to make the two groups as similar as possible, participants are assigned to one group or another at random. That means that people are put in groups by chance, like by flipping a coin, to decide who gets the control treatment and who gets the experimental treatment. This way, the two groups are likely to turn out to be pretty similar to one another. And the researchers will know that if one group does better than the other, it's because they received the better treatment, not because they were different in some important way to begin with. Difference number 3. Doctors and nurses don't know which treatment someone is getting. Researchers worry that if the doctors and nurses know which treatment a person is getting, they might treat them differently, or think they see improvement when it's not really there. This could change the outcome of the study. A common way of dealing with this is called blinding, that is, not telling the doctors and nurses who is getting which treatment. How do these three differences affect people in clinical trials? Random assignment, protocols, and blinding mean that doctors can't individualize treatment. Random assignment means doctors can't prescribe the treatment they think is better. Protocols limit doctors' decisions to change dosages or medications. And with blinding, it may take longer for doctors to recognize side effects. But to protect participants, if they aren't doing well, they can always be returned to usual treatment. There are also benefits to participating in a clinical trial. Participants in clinical trials who haven't gotten better with current treatments may get access to treatments that turn out to be helpful to them, even though they haven't yet been fully tested. The doctors and nurses working in clinical trials are often highly expert in the disorder being treated. In most clinical trials, participants' conditions are monitored more closely than in ordinary treatment. People like you can help advance medical knowledge by helping researchers figure out which treatments work better for people who have illnesses like the one you have. It's important to think about both the advantages and disadvantages of being in a clinical trial.